Thanks for having us back. I'm Dr. George Gluck, CEO and co-founder of SurgiStream. And before I get into the pitch, I want you to imagine that you're a patient and that you're going back to the operating room. You're about to have orthopedic surgery. You've been put to sleep by the anesthesiologist, and the doctor comes into the room and realizes they don't have the device or the third-party implant that they need to do your surgery because it hadn't been delivered to the hospital in time, or there was a miscommunication in getting it to the OR, having it processed. And this is fortunately very uncommon, but this actually does happen. And it really represents just the tip of the iceberg that is the chaos of surgical scheduling and logistics that continues to lack uniformity and uses a lot of unnecessary fax, text messaging, email messaging, passed through multiple people unnecessarily in an inefficient fashion. And this is a problem that SurgiStream is already addressing in our pilot city of Las Vegas, and a problem that we're really focused on. And what SurgiStream is, it's a web and mobile-friendly hybrid B2B and B2C surgical logistics company. And what it really does is it solves two problems, actually. The first problem are the patient safety issues, canceled cases, surgery, operating room delays that all lead to lost revenue and other problems. But there's also a secondary problem, which is a lack of effectively being able to target surgeons through digital ad platforms. Medical device manufacturers use these trade journals for shotgun marketing approaches and conferences, and they lack the ability to target effectively. And it's only going to get worse as there's increasing privacy concerns, as we've seen with Apple and how the internet tracks people. And that's a trend that's evolving. So it's not just advertising, but it's also education. SurgiStream, it gives advertisers and educators the ability to target the surgeon's schedule based on what they're doing. So it can deliver things just in time when the surgeon's thinking about it. So advertising for products, educational materials for products, as well as abstracts and articles. We've reached out to the American Academy of Orthopedic Surgeons and discussed this with them. And this is in line with their mission and their platform requirements to hopefully push continuing medical education credit opportunities and improve the surgeon value. This is a billion-dollar market. It really centers on a core subscription base, predominantly from sales rep revenue, subscription revenue through the device manufacturer, but also on the orthopedic surgeon and their practices, and also the facilities, the surgery centers to some degree. But the additional revenue around this in terms of the advertising, marketing, and education, just within the orthopedic segment, is in the billions of dollars. And you can also apply this to other subspecialties, urology, plastic surgery, neurosurgery, and the list goes on. So the SurgiStream platform began development in November 2018, and we began our open beta launch 11 months later, October 2019. We've raised over $800,000 since we've started, and 6 months into our launch, we started developing a good core group of surgeons to pilot this locally, and this has developed into 200 to 400 surgical cases scheduled monthly with our pilot platform, which is equivalent to over $2 million in Medicare fees for facilities and surgeons alone. And with our progress, we were accepted into the UCLA Anderson Venture Accelerator, which we just came off of over the last 6 months. And the accelerator is very helpful, pushing the company towards more cost-effective product development and identification of the most relevant user subsegments in our multiple target verticals: doctors, device sales reps, device manufacturers, surgical facilities. All of these are within our focus vertical, and they're all potential sources of revenue and clients of ours, but it really helped to focus our energies. And over the period of the accelerator, we were able to come to agreements with 2 device manufacturers, one producing over 200 in annual revenue, one producing over 2 billion annual revenue, to initiate pilot projects and contract for product development, which is currently happening here in Las Vegas, as well as West Coast, California, and Washington State, and soon to be East Coast as well. So we anticipate that early contract revenue will come in on the order of $50,000 to $100,000 for our first year of revenue this year with the platform. So our sales team is myself and my 2 co-founders, Jeff Sorensen, Brian Larson, who are both sales reps that have over 25 years combined industry experience. Our CTO oversees our programmers, and they have equity ownership in the company, and we've been with them from the beginning. and our VP Business Development has a finance background, but he has nearly 20 years of device industry sales and marketing experience. So we're hoping to raise another at least $250,000 to finish up our product development and our sales pilot programs to get us through the rest of our beta test, because this is a mission critical product. It can't just be a minimum viable product. It really needs to be mission critical for surgical scheduling. And once we get through this open beta, we plan to switch to a subscription model, which we're looking at. I know this will be a question. We're looking at $50 a month for users on average between the sales reps and the physicians. And we have over 200 users on the platform. And the nice thing about these pilot studies is that the goal is to incorporate the platform into these large corporations, which will, just within the pilot group, is over 300 to 400 sales reps, which would put us at over 15,000 to 20,000 monthly recurring revenue. But nationally, between these two companies, it's over 10,000 sales reps. That alone would put us at over $500,000 in monthly revenue, which would give us strong footing and get us well on our way to pursuing the advertising component of the platform. And that concludes my presentation.